Okay, right. I hope that's recording now. So maybe so I've got Alice in the top left of my screen. So maybe we could start introductions with Alice.
Hello, I'm Alice. I am second of 6 years part-time PhD. I'm looking at mental health in professional actors in the UK.
Thank you.
Are you an actor yourself?
Sorry, Kate.
Yes. So I trained as an actor years ago, and yeah, that's how I came into it, because I was involved with a group around disability in actors, and because I have an invisible disability, and I found myself just in these conversations going, what about mental health? What about mental health? What about, and realise that actually the research hasn't been done, and that's how I ended up here.
Oh, right, cool.
And your PhD is so important at the moment as well, isn't it, Alice? Because the people that you were wanting to do your PhD with have completely had the rug pulled out from underneath them throughout the pandemic.
Yeah, I mean, the difficulties being faced by that sector at the moment, they are talking in terms of existential crisis, catastrophic losses of buildings, resources, workforce, the whole lot. We're looking at people, you know, even students not being able to finish their courses, how you physically do the work from here on out. So it's interesting. Let's go with interesting right now.
It certainly added a new layer to your work, hasn't it, and made it even more important.
Yeah, and actually what has been nice is, so the big union for actors, Equity, is getting a new general secretary, and I've been able to have conversations with both candidates, and they've been really, really good. We've had a bit of trouble with what Equity did around mental health, and the two candidates have both really got switched on ideas. They're looking forward, they're very aware of it as part of the rebuilding process that needs to happen. So it's sort of a terrible time, but also quite an exciting time to be doing it.
Yeah.
Slightly overwhelming time now and again.
Oh.
Yeah, I think that's probably going to be one of the themes of our conversation, and I'm sure the experience of lots of PhD students as well, isn't it? Kind of just feeling a bit overwhelmed at the moment. Kate, your PhD is very topical at the moment as well. Do you want to just do a quick introduction?
Yeah, so I'm Kate. My PhD is on secondary traumatic stress in mental health practitioners. So what secondary traumatic stress is, it's basically the development of PTSD symptoms in clinicians, but from their clients' trauma stories and experiences. Yeah, so my research has completely changed, as you can imagine, due to the pandemic. I've had to completely redesign it because it was meant to be in the labs, taking saliva samples and touching people's heads to put all the FNIRS, brain activity measures on. So it's basically split in half, and the first half is going to go online now, which is the ethics application that I've been writing. And we're going to be looking at predispositions, like are there certain characteristics people may have, such as like tendency to ruminate, attachment style, is empathy either a protecting factor or actually making practitioners more vulnerable to developing secondary traumatic stress. So at this point we're having a look at the predispositions, and then hopefully when we can get back in the labs, we'll then like sort of parallel these up with the biological mechanisms and reactions they have to listening to a trauma story, and sort of see what's going on. So yeah.
Yeah. Hence feeling a little overwhelmed maybe.
Yeah, just slightly, but I think everyone is.
yeah, it's the way at the moment. So we're on week 13 of lockdown now, aren't we? Is that right? Slightly
I don't know.
It's either
just
week
all merged
12
into one.
or week 13. Either way, we're well in. We're far down the line. Costanzo, we should probably just say you're joining us from Sardinia, so obviously you've had quite a different kind of timeline to those of us here in England. Do you want to maybe just say a little bit about how things have been there and what your PhD is on?
Yeah, I'm Costanzo Frau. I'm a psychotherapist, and I'm work with personality disorder and dissociative disorder in my private practice. I'm very interested in developmental psychopathology, so I'm going to do a PhD about the link between attachment and autonomic nervous system activity. So I'm going to study this link because I'm working with the dissociative patients, so the attachment in this kind of patients is very disorganized and complicated. So I'm very interested in this topic.
Brilliant, thanks Costanzo. In some ways there are some parallels between your PhD and Zara's. So Zara's, sorry Zara, I'm about to introduce your own PhD, go on.
All right. I'm Zara. I started in January, so first year of 5-year part-time PhD. I'm looking at how kind of emerging multiplicity comes about in adolescence, so focusing more on kind of young people that maybe hear voices or other unusual sensory experiences, but don't necessarily want a diagnosis or have a diagnosis of dissociation, and hopefully going to make kind of some resources and training for practitioners that maybe don't necessarily either understand it or even believe in it, and just kind of try and make it less stigmatized, especially kind of in the media and everywhere else. And then, yeah.
Are you focusing, Zara, more on things like psychoeducation, or is it sort of outward facing public engagement? So is it kind of, by which I mean, is it in a pre-existing known group, or is it more to general public, or is it a bit of both?
A bit of both. So trying to kind of get an understanding from the experts by experience, because there's really no consensus as to what multiplicity is. It kind of is different for everybody, but then trying to create some resources for the practitioners and for like the people that work with CAMS and things. So then there is kind of a set protocol or set kind of things that they could work on. So then people in the UK know that if they do go and speak to somebody, they can trust them, and like they'll go and speak to somebody that believes in it and doesn't just tell them that it's just an imaginary friend and you'll get over it at some point. Right.
Oh, that brings in the whole line between imaginary friends and yeah.
Yeah, absolutely. And I suppose that leads us neatly into perhaps introducing Abby and Lauren, who are both doing projects around imaginary companions in childhood as perhaps part of that very underdeveloped continuum of understanding. Abby, do you want to maybe just give a brief summary of your project and where you're up to?
Yeah, so I'm Abby. I'm currently in the MA year at the moment, so I've not actually got started with my PhD. So my overview is probably going to be quite a bit briefer than everybody else's because I'm not into it properly yet. But essentially, I'm on the Young Voices project, and like Sarah said, we're kind of looking at, I guess, unusual sensory experiences and imaginary companions. So thinking about kind of commonalities, differences, sort of appraisal of like carers and family members and how that maybe influences on the child and young person's experiences of kind of what's going on. That's very, very brief.
We've got the gist.
I'm sorry, I've probably not done it justice, Sarah. A lot more to it.
No, great job. Lauren, do you want to just mention what your PhD is on as well?
Yes, so I'm Lauren. I'm in my first year of my part-time PhD, and a lot like Abby, I'm looking at how people perceive imaginary companions and to hopefully build a bridge between imaginary companions and using them for good purposes, like to build resilience throughout life. So as there's a lot of good qualities that come from imaginary companions. So to be able to use them like to build resilience, could help people across the board. But I'm still in my first year, so I haven't gone very far yet.
Oh, that's great. Thanks, Lauren. I think that's the nice thing about this group. Everybody is at different stages, which I think is probably quite helpful in terms of reducing the likelihood of kind of comparing where you're at to where other people are at, which can be so easy to do during any period of study, can't it? To kind of think, oh, so and so's already finished their lit review, or why haven't I started data collection yet? I think it's probably really quite nice to have just a bit of reassurance that, you know, actually each individual PhD runs at its own pace and runs its own course, because they're all so unique. We've been meeting for kind of just casual chats and cups of coffee via Zoom, haven't we, for the last few weeks, and a few things have come up in terms of how difficult it can be to kind of keep on top of tasks and to keep the motivation up, and kind of those feelings of just it all being a bit much sometimes and feeling a bit overwhelmed. But one of the really important kind of commonalities that we've got within our group, obviously, is that we're all very focused on mental health, and some of us work in mental health. We all do research in that field, so I guess we're perhaps benefiting from those insights at the moment in terms of having a few things that we know help us look after ourselves. So maybe we could just think about some of the things that have been helpful over the last nearly 3 months. I think I've started forgetting a bit how long, you know, we've all been kind of isolating and working remotely, and sort of how life has changed so much. Who wants to throw us an idea first in terms of what you found useful to kind of look after yourself through these weeks and months?
I feel like I've been in lockdown for an extra few weeks because we had symptoms about 2 or 3 weeks beforehand, and I've got 4 young children at home, so it went through the house, and I really benefit from going on walks, really do, just to break up, because I'm in my first year. I'm doing a lot of online learning rather than like data collection and things. But going on walks just for an hour a day, it clears your head, and it puts you in a much better place to sit down and actually focus.
Yeah, absolutely. I totally second that. We've sort of done the same walk virtually every day, and one thing I've noticed, and I've noticed myself noticing that I've never seen this before because I've just never had that much time out walking about, is just seeing the seasons come in. Like, we've seen stuff go from like middle of March, where, you know, nothing was really alive, to just beautiful flowers everywhere, and just really noticing it for the first time. It's been quite a nice sort of mindfulness thing as well, really, just noticing it all change every day. Has anyone else been doing walks more or less than usual?
I've barely been out, but I've had a slightly odd situation. For the last 6 weeks, I've been locked down with family in an extended bubble because there's quite significant caring needs. So although I haven't really left the house much, because when we have the kids over, because they're small children with additional needs, it's been similar. We've watched the garden change, and one of the children really loves learning about flowers and getting to know how is watching the roses bud and bloom and then die. We had to have a discussion about why the petals were on the floor and things like that. And I think it's really good to have that connection with the physical world. As well, making sure you do your stretches. I got my roller skates out for the first time.
Oh, no way.
I've been on roller skates, and it's the weirdest feeling. There are muscles I'd completely forgotten existed, but it's also really kind of energizing, and just going, I would never have done this. This is not something I would have had time to do, but it's just getting those things that get your body going. I think for me the danger is that we sit here the whole time, and you can actually get very stiff and tired and digital overload, eye strain. There's something very nice about just moving. It's very, it's lovely.
Yeah, absolutely. I think I had about 6.5 hours of conference calls yesterday, and it got to about 5:30 and my eyes were so dry. I went out for a run, and it is amazing how much better you feel just from moving and looking at real things rather than a screen.
Yep.
Can I just say one thing that I've kind of been struggling with in lockdown?
Yeah,
is
absolutely.
We've got two, I say children, but they're 12 and 13, so on the cusp of proper teenage years, and obviously they love the phones, they've got social media, they're on it all the time, and trying to explain to them how to sift through real news and fake news has been really, really challenging, especially with the riots that have been going on, the movement, the pandemic, all these massive current situations that are going on. And because obviously, especially on social media, everyone can publish anything, and it's coming from all directions, from, you know, probably not great sources a lot of the time. So they come running in and they'll say something's happened here or something's happened there, and it's very draining. It can get very, very draining, because obviously this kind of news, usually fake news, is not stuff you want to hear anyway, but then having to battle with your kids to explain to them that this might not be true, and okay, how can you say that, because it's on the news, or it's on Facebook, it's on Instagram. I've found that really draining, I think.
Yeah, I think that's something that a lot of, well, adults and those with children have commented on a lot through all of this. I mean, a bit like I was saying to you all just before we pressed the record button, over the last few weeks, my news consumption has plummeted, because I just know I just need to sort of shield myself from it a little bit, and just sort of pick out a few reliable bits and pieces. But I think, you know, when it's young people who just perhaps don't have those skills yet about evaluating where information's coming from and how reliable those sources are, and, you know, what to take in and what perhaps not to, it's really tough, isn't it? It gets in the way of, yeah, definitely. I mean, I think having done quite a lot of research online with teenagers and young adults over the last few years, it does, you know, bring home how much they have to say and how much, you know, they've got to help us learn as well. But I suppose, you know, issues like the one Kate raised around just how much unhelpful content is out there as well, it seems to just sort of make a lot of noise in spaces where we're all quite confined, and that can obviously kind of, you know, heighten how everyone's feeling and polarize opinions and conversations. You know, and that goes on in, you know, research spheres as well, doesn't it, as well as families and just kind of discussions. There is an awful lot going on, which is, you know, probably where some of those feelings of feeling a bit overwhelmed comes from. But, you know, thinking back to a conversation we had a few weeks ago within our PhD group about how it can be difficult to kind of keep the motivation up for work. I think when there's so many massive things going on in the world around you, suddenly perfecting whether or not you're going to use an or and in a systematic literature review search suddenly seems less important, even though, you know, it's still really important work to you. And, you know, I think we probably are, you know, limited in lots of ways as to what role we play in terms of, you know, being a good ally, amplifying, but in terms of kind of how that translates to other aspects of life and study, what are some of your thoughts as to kind of what's helped you kind of push through on those days where it does all just feel a bit tough and more difficult than usual?
I've been doing that
other courses.
I've been doing that other courses, so I don't feel guilty about just like sitting and watching TV. So I've been learning sign language, I did suicide prevention training, and I've done some psychological first aid courses, just online ones. But I think taking the time out to go, I can do something that's a bit more relaxing, or something that isn't just you're spending 40 hours a week reading articles, but I don't, then I'm not like, oh, what have you done today? Oh, I've just sat and watched 10 hours of The Real Housewives. So
can I just say, Zara, I'm really reassured that you do that, because from my perspective and my inbox, you work really hard. I'm very reassured that you have time for other things as well.
Oh, definitely.
I think for me, the motivation has kind of come from staying involved with my industry, because I've been able, weirdly, because for various reasons, I've actually been able to get to more events during lockdown than I was prior to lockdown, because so much of it's gone digital. So I've been able to talk to people all over the country and get a real feel. And it's kind of really reminded me why I started doing the work in the first place, what the needs are, and what I can contribute. And that's actually quite exciting, as I said earlier, at the same time as being a little bit overwhelming. But it certainly keeps you focused.
Yeah, and knowing that what you're doing really matters, and, you know, hopefully will have a really positive impact as well. Hopefully that keeps you going.
I think with a benefit of the lockdown, like you were saying, Alice, was there's a lot of the other stresses, like making sure your kids have days out, or making sure you're doing this, that and the other with everybody, and seeing people, they've kind of evaporated because you're in this bubble now. So it's easier to be able to focus on fewer things, and you don't feel as guilty.
Yeah, I think like I'm still working as a nurse 2 days a week, a community mental health nurse, and that's something that I'm finding from like people that I'm speaking to as well, like people sort of feeling guilty for kind of seeing the positives in the lockdown, because they've got more time to do all those things that you've been talking about, and kind of all these other like external pressures of having to perform, I guess I say that in inverted commas, has kind of like gone away. So they're just kind of focusing on like the simple things, I guess.
Yeah.
So,
yeah, I really found that helpful.
Yeah.
How are you finding juggling those two roles, Abby, in terms of nursing and your PhD? MA.
Yeah, it's okay. Kind of do job work on one day, and then uni stuff on another day, and just kind of keep it separate. So the days that I'm at work, the days that I'm doing uni work, I'm doing uni work, and just kind of trying to do it that way, really. But yeah, it's challenging, but you know, it is what it is, and I'm learning a lot from the experience. So
might we be able to think of one more thing that's come up either in our discussion so far, or something that may have come up over the last week or two, in terms of anything that helps kind of just, I suppose, find maybe some thinking space for the work as well? I think, you know, when there's so much going on in the world around us, actually just finding some kind of thinking space around particular tasks or pieces of work that you're doing can sometimes get a bit clouded. Has anyone found any particular kind of techniques quite helpful, other than what we've mentioned? What are your thoughts around just sort of being with other people who are at a similar point in your studies? Because I guess we've kind of been having our kind of little PhD get-togethers, and I know the kind of journal clubs carried on going to some extent, and there have been other kind of support approaches around the university. What's been kind of particularly useful from a sort of shared space community perspective?
I think, like, obviously I'm on the MA at the moment, and there's a group of us that have got like a WhatsApp group, so we kind of use that to stay connected. Like, we essentially message each other pretty much every day, to be honest.
And it's just nice to kind of obviously stay connected with your peers and things like that, but it's also reassuring as well. So to kind of know that other people are sharing the same anxieties, and maybe if you're having a day where you're feeling a bit extra rubbish about things, or it's just getting you down a little bit, they can kind of lift your spirits a little bit and just kind of cheer you up. So I'm finding that really helpful.
Yeah, I've just had like sort of like, I don't know, Friday night chats with a group of PhD students that I became friends with, and I don't think any of them are in their first year, actually, the second year and third year. And it's been really interesting for me, like listening to sort of the struggles that they're having later on in the PhD, like generally, and because of the pandemic. So that's been quite good. And because I'm in part of like the students that use the labs, the people that use the labs, they get a buddy when they begin their PhD that's in this, and the buddy's in their second year. So they've sort of done the rounds, it can like answer any questions you've got. So I've actually suggested to Hugh McLaughlin that maybe this should be instilled for all PhD students in our department, especially at this time where we can't physically meet each other. I thought it'd just be really nice for people starting their PhDs in the pandemic, so like now or in September or maybe even January, that they have a point of contact that isn't a staff member, that's a PhD student that sort of knows the answers, you know, like what's an RD1, what's a Gantt chart, blah blah blah, things like that you sort of think, what does this mean? So I think he's going to run with that, so I thought that'd be quite a nice thing to do.
Yeah, really good idea.
I mean, for me, just the coffees, I find them so good. I'm in absolutely. I'm in a slightly weird position because I'm not. I am split across psychology and theatre. Theatre is much smaller, and I'm the only PhD student, so I'm in this kind of weird space with it. So simply seeing other faces and hearing people going, yeah, I'm struggling with this too, it's such a relief. It's such a relief. Particularly in my first year, I was actually very isolated because I was alone in the department and I didn't have a group to work with. It's just so nice to feel like, oh yeah, there are other people, and yeah, these are all things that everyone experiences, because it's very easy, particularly at a time like this, to look at it and go, what have I done? I'm doing it all wrong. And just to know, no, it's okay. And particularly as a part-timer going, it's 2 of 6 years. 6 years. You're not even halfway through yet. Breathe. There is time. Breathe.
I think breathe is a brilliant point to finish on. I think when all else fails, good deep breaths. Probably a good tip all around. We've got less than a minute before Zoom calls time on our meeting, so shall we move over to our next link? But thanks everybody.
Yeah. I have to go, so I will see you all soon.
Okay, see you, Alice. Take care. Bye. Bye.